David Harrison here, and welcome to the Best Doctors Unified Physician Workspace training video. In this video, we will review how to utilize this tool to efficiently score and analyze Best Doctors cases. We will also review how to document report delivery within CRM. Let's dive right in. When you are assigned a case, you will also be provided with an email that outlines the key players in that case, the case MA, case coordinator, and PSD MA. You'll also be provided with a link that brings you to a blank survey like this one. You'll fill in the case number. I'll be Paul Cohen today. Case MA is Karen Arbini. Case coordinator is Michelle Anderson Boswell. And PSDMA is Sandra Bote. And let's say this is a case of a member with aortic stenosis wondering if he should have aortic valve replacement. First thing that's important to do is to score the different case activities. In this video, we won't be going through the specific criteria for scores in detail, but just know that if you click on this question mark button, it will automatically bring you to a pop-up that reviews all of the criteria for these different scores, and you'll be able to utilize that at any point in the survey. Getting back to the tool, let's say service line assignment does not meet expectations, should have been IC inbound because multiple comorbidities. Medical record collection, let's say it didn't meet expectations, did not collect key echo. Expert case matching, met expectations. The intake really was a very good intake, exceeds expectations. Great description of current symptoms. Let's say, you can work on this tool once this, the BDR is complete. But let's say you've finished writing your clinical summary and you would like to score the intake, the service line assignment, and the medical record collection while all of these are still fresh in your head. You can just go right down to the bottom, click on Save and Continue Later. You can save the, your scores for now, and then come back to the survey once the expert report is in and you need to do additional work. If you'd like to do everything all at once, that's fine as well. So, case activities. Are there opportunities for clinical integration? Yes, we should evaluate for nutritionist weight loss, and this is a member who also could use smoking cessation. The expert report. The expert's name is Dr. Demento, and that you really only need if there's multiple reports so we know which scores apply to which expert report. You approve the report. You can also reject it or say it's not quite ready yet, it needs an addendum. But it's approved, you score it, it really was a very good report. Then it's important to think about how significant was the impact of this report on diagnosis and subsequent management. In this report, let's say it didn't change the diagnosis of aortic stenosis, but it significantly reevaluated the severity of the aortic stenosis after review of the echocardiogram. So we'll say that actually this is a moderate impact case. Therapeutic impact rating, the member had been considering an aortic valve replacement, but we said it's really not necessary because the aortic stenosis is not so severe. So we'll say a major impact there. Now, it's important to understand the different elements of the impact that we've realized on diagnosis and treatment. So here, you'll choose one of the following, and anything with a star is a required field. Confirm, change, refine the differential diagnosis, revise the severity of working diagnosis. So the person does have aortic stenosis, but it's not as severe as anticipated. There was important change in interpretation of the echocardiogram, perhaps looking at some of the cardiac enzymes, people reevaluated the significance. We may have identified premature closure everyone was attributing the patient's dyspnea to aortic stenosis, and they were not thinking of a broader differential diagnosis. And the expert may have recommended to get another stress test or another echocardiogram, to try a certain medication, and also to get pulmonary function tests. Then there's also impact on the therapy. So we changed therapy because the member had been recommended to undergo aortic valve replacement, but we recommended starting new medication to see if it helps. Chemotherapy, hormonal therapy, not applicable. Surgery, recommended against surgery. Non-surgical interventions, things like injections, that's not applicable here. Radiation, not applicable. And the expert may have recommended weight loss, diet change, acupuncture, and other. Perfect. So then it's very important for our outcomes and case analysis team to outline the diagnosis before and after treatment, as well as the major proposed diagnostic studies and therapeutic interventions. So primary diagnosis before is aortic stenosis. After is dyspnea. And there's a broader differential diagnosis. It could be obesity, deconditioning, interstitial lung disease, or we'll say asthma. Primary proposed diagnostic studies, there were none proposed, and we afterwards was recommended a repeat echo and lung function tests. No secondary proposed studies. Primary proposed therapeutic intervention is bioprosthetic AVR, and afterwards it is pending because it really depends on what the additional diagnostic studies show. Now, it'll be important to attach the BDRS. You'll have access through Word to a blank BDRS template. So for this member, you'll go and say, Dr. Demento recommends that you and your treating physicians review the following assessment. You are lucky to have best doctors, but you should consider not having that surgery. By the way, you should try to lose some weight. You'll save that and attach your BDRS here. Now, is this a great case? Yes, this is a great case because it really had a very profound impact on management. So this would be a 57-year-old male with dyspnea attributed to aortic stenosis. Review of the echo showed disease was not severe and dyspnea likely due to other causes. Great. Now, for lead associate physicians who are auditing the case, they will go to this part. I will be IAL and scoring the clinical summary. It was a really good clinical summary, so we'll say exceeds expectations. The BDRS rating only as does not meet expectations or meets expectations. The BDRS that I wrote just now really stunk, so I'll say unacceptable, does not meet expectations. Report delivery documentation we'll get into, meets expectations. And case analysis. Overall, how in line with our currently accepted criteria were the scores assigned by the associate physician? And overall, the associate physician was on point with scores and also identified key shortcomings in medical record collection and service line assignment. So this meets expectations. And that, my friends, is all you need to do with the Unified Physician Workspace. Now, so what you would do at that point is submit your survey, and someone from the MDC assignment team will extract key pieces of data that you've put in here. For example, the expert scores and whether or not the report is accepted or rejected, and we'll enter that into CRM. Now, if you've performed report delivery, it's important to document report delivery as well. So if you go into CRM, we have our case here, Bruce Test 4. You'll open up the case, and for report delivery documentation, you will do two things. For those of you who haven't used CRM, you'll come to really appreciate how slow and every single click is. So first, you'll want to document what was discussed in report delivery. So the associate physician report delivery note, you can add a new note, but I wrote one here. We discussed the significance of the revised echo interpretation. We reviewed the differential for his lightheadedness and dyspnea. And discuss next steps for testing. The member's very grateful, and I captured a quote right here. To think that Best Doctors has likely saved me from unnecessary surgery. Amazing. He does plan to share the report with his primary care physician, but he's not so happy with his cardiologist and he would like to see a new cardiologist. An FBD, Find Best Doctors service, was requested, and he is planning on not having the proposed surgery. So those are the key elements to outline in the report delivery. It's also important to document these empowerment questions. Basically, we capture the level of a member's empowerment before the interconsultation, and then want to capture their level of empowerment after the interconsultation so that we can compare the two. So you would go and click on Outcome Summary, then click on this little box, and then yet another window would pop up. The MA at the beginning of the case has captured the member's feeling. Do they have confidence to make care decisions? I thoroughly understand my diagnosis. I'm completely confident in my diagnosis, so on. You'll ask the member the same things. It takes just a minute during the report discussion, and now they have a high confidence and ability to make decisions. They do understand their diagnosis. They're confident in their diagnosis. They understand their treatment plan, and they're very, very confident in their treatment plan. Then you would just save and close this, and close this, and you are done. So that is how you complete the Unified Physician Workspace. Submit your analysis for collection, and we can generate reports off of these analyses, and then document report delivery and empowerment questions within CRM. Thank you yet again for your continued involvement with Best Doctors, and never hesitate to let me know if you do have any questions. I would be remiss if I also did not thank the amazing Journey Murray for her tremendous work in helping to put together this Unified Physician Workspace. Thank you very much.